Okay, we're on this book here, Prevent and Reverse AFib and Congestive Heart Failure by me, Pete Rogers. We're on page 166, illustration 9-12. We're talking initially about leaky gut, but here it's going to be in the context of how this causes brain damage. So a normal gut, you eat dietary fiber, it goes to these smiley face bacteria, the good bacteria. They convert it into short-chain fatty acids, in particular the 4-carbon butyrate. 4-carbon butyrate is used by the gut lining cells called enterocytes. It's the enteric tracts, another name for the intestinal tract. It's a single cell layer thick. These enterocytes use the butyrate to make tight junctions, TJs. And then the TJs prevent bad things from getting across the gut wall, the gut lining. If you don't have the dietary fiber, you get leaky gut because the tight junctions aren't made adequately. And then bacterial endotoxins will get across and they'll get into the blood. Gram-negative bacteria make LPS, lipopolysaccharide. Gram-positive bacteria make LTA, lipoteichoic acid. In addition to a lack of dietary fiber, and by the way, the average Americans eat about 5 to 10 grams of fiber per day, which is next to nothing. Our ancestors ate 50 to 100 grams. Okay, Burkett thinks they routinely ate over 100. Okay, my diet, my routine is usually about 100 grams a day. Okay, anyways, so the typical American is deficient in dietary fiber. Okay, typical American is deficient in magnesium, potassium. Why? Because those are the things that come from plants. They don't eat enough plant foods. Anyways, besides the lack of dietary fiber, there's a lot of other things that will predispose to leaky gut. Taking antibiotics, eating oils, omega-6 oils, cooking oils, excessive amounts of saturated fat, excessive amounts of dairy, the non-organic food, glyphosate, the herbicide, excessive psychological stress, spleen stink shutdown, vasoconstriction to the gut, caffeine, vasoconstrictor, just like psychological stress, alcohol, emulsifiers in processed food, NSAIDs, non-steroidal anti-inflammatory drugs, aspirin, dishwasher soap, BPA. There's a whole bunch more. The aluminum in tap water, fluoride in tap water, excessive amounts of chlorine like in tap water. That's why you got to filter your water. Even a carbon filter will help get the chlorine out. Corticosteroid medications. Having had a stroke, traumatic brain injury, something that causes leaky blood-brain barrier causes leaky gut, and leaky gut things cause leaky blood-brain barrier. Because the butyrate normally gets into the blood, goes up to the brain, and at the endothelial cells of the blood-brain barrier, it helps them to make tight junctions as well. So anyways, now I'm going to show you what happens when you get LPS and LTA in the blood. So those are endotoxins, so to get those after eating is called postprandial endotoxemia. Prandial means to eat. Okay, so in the blood, you have these clotting proteins called fibrinogen, and they're shaped like an alpha helix, which means like a slinky, a cylinder, and they don't stack too well. When you have LPS and LTA in the blood, they cause them to flatten out like beta-pleated sheets. Secondary protein structure is what we're talking about here. And that secondary protein structure change causes them to stick together like a deck of playing cards, and then they precipitate out a solution. To precipitate out a solution in blood plasma is to clot. So you get these clots formed, and they have an abnormal shape. Their secondary protein structure is now beta-pleated sheet, or flat, rather than alpha helix, cylindrical. So this is called an amyloid transition when that happens. So these are called amyloid clots. Some authors call them fibrinoid clots. They're relatively refractory to lysis, meaning that they're difficult to dissolve. Typical size 2 to 200 microns, and they'll plug up small arterioles and capillaries in people's bodies, and this will contribute to cognitive decline and to atrial fibrillation. The two best writers on the subject are Douglas Kell and Etheresia Praetoris. Douglas Kell is a PhD from England. Etheresia Praetoris is a PhD from South Africa. They've done work on this. They deserve a Nobel Prize, but it'll never be awarded to them because useful stuff like this gets hidden from the public. They only give Nobel Prizes to people that are helping the drug companies to make money. Okay, it's pretty obvious. Ask yourself, how come Walter Kempner doesn't have a Nobel Prize? How come Nathan Pritikin doesn't have a Nobel Prize? How come John McDougall doesn't have a Nobel Prize? How come Esselstyn doesn't have a Nobel Prize? Okay, because they don't want the public to know about this stuff. Okay, the game is rigged. It's just a fact. Okay, none of those guys are in the medical textbooks. The most important information is not in any of the medical textbooks. That's for a reason. Okay, here's what happens. So when you get leaky gut, you get leaky blood-brain barrier. The bacterial endotoxins get into the blood. Well, then they also partially get into the brain. All right, and then when they get into the brain, they activate the microglia. Microglia are the macrophages of the brain. They're part of the immune system. They're the guard cells, the sentries. Okay, the sentinel macrophages. And when they get activated by this, they release these toxic chemicals. and that will do damage to the brain cells in the vicinity, collateral damage, okay? Just so you know, everybody knows about endothelial nitric oxide being a good thing, released by the arterial lining cells to vasodilate. Caldwell Esselstyn speaks about that all the time, and why eating a low-fat vegan diet nurtures that in your blood vessels. That is true, that is good. And there's a lot of fiber in Esselstyn's diet, which also prevents leaky gut. But there is another type of nitric oxide, so you're aware of it, coming out of these microglia cells, brain macrophages. And this one is called iNOS, for inducible nitric oxide synthase. So in an arterial endothelial cell, it's just little tiny bits are squirted out all the time to keep the artery open, and they're antithrombotic because it's a gas. Drifts into the lumen, inhibits platelets from clotting, drifts into the wall as a gas, diffuses, and it causes the skeletal muscle cells, vascular smooth muscle cells, to relax so the artery dilates. That's all good. But what I'm saying is it's a totally different ball of wax in the brain microglia. iNOS stays on much longer and produces far, far, far more nitric oxide, to the point where it starts having toxic effects, because the purpose of it in this context is to kill invading bacteria. Okay, and what it ends up doing is trying to sterilize the area around itself where it sees incoming bacterial toxins, and in so doing it kills adjacent brain cells. And so people lose brain cells, okay, and you don't want that. It's a gradual, slow process, and it ends up being such a small thing locally in little bits at a time that it ends up manifesting like apoptosis, such that it's not visible on a brain MRI. There's a lot of disease not visible on a brain MRI. Brain MRI only shows you a big sudden stroke, okay, or it shows you an old stroke. But it doesn't show you apoptosis. It doesn't show you, micro disease of microglia destroying neurons along the periphery. But this is a major thing to know about. Because I look at tons of brains, many thousands of them. And what I see almost all the time, 9 times out of 10, shrunken brain. Not that much strokes. A lot of periventricular flare hyperintensity suggestive of small vessel chronic atherosclerotic disease, ischemic disease. Okay, but I don't see... you don't see this, and it's shrinking these brains as contributing to apoptosis. Okay, and also being iron overload does the same thing. Another thing that's not often talked about is you'll hear all this in every brain report. It's part of every neuroradiologist macro to say there's a mild, moderate, extensive amount of flare. Flare is a brain MRI sequence. It's really a T2 fluid suppression sequence. And there's a mild, moderate, extensive amount of flare hyperintensities, meaning of old strokes, deep white matter strokes. And what I'm saying is every one of these has its own penumbra. Penumbra means twilight in Greek, meaning something that's, not fully alive, fully well perfused by blood, but not fully dead. It could potentially be saved. And every one of these things has a penumbra, vulnerable to extension, meaning loss of more brain cells. And they tend to gradually just keep getting bigger and bigger until they coalesce. And then you end up with extensive coalescent periventricular flare hyperintensities, and the patients progressively cognitively decline. So what I'm trying to say is this game never goes away. You don't have a choice. You have to play this game. And the only smart thing to do is to maintain your blood-brain barrier, maintain your gut barrier by eating adequate amounts of dietary fiber and avoiding all the stuff that's toxic to your gut, like excessive dietary fat, like dietary oils, like tap water, okay? That's the game. Because otherwise you just keep losing brain cells, and eventually you've lost too many. It reminds me of the old analogy of being a rivet popper. They said, what if you had an airplane mechanic who just kept popping rivets out of airplanes? The plane would still fly quite well for a long time, but you keep popping those rivets, popping one rivet a day. There's going to come a time, 6 months from then, a year from then, a year and a half from then, the plane's not going to fly. Okay, it's not going to fly well. And that's what I'm saying people are doing to their brains. This is the way it is. This is not kind of common. This is super common. I see this all day long, every single day. And that's the game that's being played. You have to play the game. You don't get to not play. So you might as well learn how to play the game and win, which means you eat a low-fat vegan diet. You'll get your adequate fiber. You'll avoid the things that cause leaky gut. Filter your water. Avoid the tap water. It's another way you protect your brain. Okay, and another point I want to make is the average American male is iron overload by the time he's in his mid-20s. The average woman, about in her mid-50s when she's postmenopausal, stops menstruating, so she starts to accumulate iron. And you only have so much capacity to store it in your cellular storage molecules, your ferritin. Okay, each one holds about 4,500 molecules of iron. And once you overwhelm it, then you get free iron. You get free iron in your mitochondria that can destroy your mitochondria, free iron in your blood that can run this Fenton reaction, Fe for ferrous for iron, like rust, and Fe to remind you of the Fenton reaction, which contributes to, this is called ferrous redox cycling, the cycle back and forth between Fe2 plus Fe3 plus. It's called a transitional metal because it has a variable valence, meaning a variable charge. And it can give off electrons in this process. The hydrogen peroxide form hydroxyl radicals, and that will also cause amyloid clotting of, amyloid distortion of fibrinogen from alpha helix to beta pleated sheet, and the subsequent amyloid clots. So you can see the average, average chump has leaky gut, and they're iron overloaded, and they're just, talk to any internist, in a regular hospital. They'll tell you the majority of patients over 60 are cognitively slow. Okay? It's just the way it is. That's another reason why you ever wonder why doctors talk so dopey. Well, hello, Mrs. Jones. How are you today? It's because they always assume the patient's mentally slow until proven otherwise, because they usually are. Anyways, we'll leave it at there for tonight. Hope you found that helpful.